Okay, picture this. You're sitting in your car, the engine's off, you're parked in a lot you've never been to,
Hmm.
and you're just scrolling through your phone, right? Checking emails you don't care about, just stalling.
Oh, I know this feeling. The universal pre-appointment anxiety.
Exactly. Because in about 5 minutes, you have to walk into a new doctor's office. But this time, it's a chiropractor.
Ah, so the questions are a little different.
Totally different. They're bouncing around your head like a pinball machine. Is
Hmm.
this gonna hurt? Are they gonna twist me into a pretzel? What is that sound gonna be like?
And the big one, I think, for a lot of people is this going to bankrupt me? Or am I about to get trapped in, the Hotel California of healthcare?
The lifetime contract fear.
I'm
So usually we're tearing apart some dense study or, a heavy nonfiction book. Today is different.
very different.
We're unpacking a document that feels, well, it feels shockingly transparent. It's a guide called The 20 Questions Every New Chiropractic Patient Wants Answered.
And this comes from the team at Valley Chiropractic. What really stood out to me right away was the tone. It's not a medical journal, and it's definitely not a sales pitch.
No.
It just sounds like it's written by doctors who've been doing this for, I think, over 30 years, and they've just heard every single fear and excuse.
They actually call it a no corporate BS guide. So our mission today is to use this text to kind of decode the whole experience. We're going to strip away the stigma and just look at the actual mechanics of it.
Think of this deep dive as a tool for patient empowerment. Whether you're a total skeptic or you're just someone whose lower back is screaming at you right now.
Okay, let's start with the big one, the sensory thing. The sound that genuinely keeps people away. Question number 3 in their guide is, what is that cracking sound? Am I breaking something?
It really is the defining characteristic, isn't it? That crack. For some people, it's like this ASMR bliss.
And for others, it sounds like structural failure.
Exactly. But I think the common assumption is that it's bones rubbing together, like
Right.
grinding.
Which would be terrible.
Yeah, if your bones are grinding, you have much bigger problems.
Yeah.
No, the source clarifies this really well. That sound, the scientific term is cavitation, is just a gas release.
A gas release. So it's about pressure, not
Yeah.
not friction.
Exactly. Your joint is like this sealed capsule full of fluid, right? Lubrication. When a chiropractor applies that quick, specific force, they stretch the capsule.
Okay.
The volume inside increases, pressure drops, and dissolved gases in the fluid nitrogen, carbon dioxide, they form a bubble and pop.
So wait, is it literally the same thing as cracking your knuckles?
Identical mechanism.
Okay.
And here's a cool nuance from the guide. You know how you can't crack the same knuckle twice in a row?
Yeah, you have to wait a few minutes.
Right, because it takes about 15 to 20 minutes for those gases to dissolve back into the fluid. So if a joint pops during an adjustment, it physically can't pop again for a little while.
But does the sound even matter? I think we all equate the pop with it worked. No pop, no success.
And that is a huge misconception that Valley Chiropractic really tries to dismantle. They stated so clearly, silence doesn't mean failure. Noise doesn't mean success.
Some joints are just quieter.
Exactly.
Hmm.
The goal is restoring motion, not creating sound effects. And I love that they said if you're someone who genuinely hates the noise, they have gentle techniques that don't make any sound at all.
Okay, so that's the sound. Let's pivot to the next level of anxiety. Safety. Question 4. Is chiropractic safe?
I mean, they're chiropractors, so of course they're going to say yes. But they did bring some data that I found pretty compelling.
But the comparisons were striking.
Yeah. They note that a serious complication is incredibly rare. We're talking less than 1 in a million.
And they put that up against things we do every day without thinking twice.
Right. Like, you're statistically more likely to have a serious adverse reaction from taking ibuprofen for that pain than you are from the adjustment itself.
The one that really hit me was the chair comparison, that just sitting in your office chair for 8 hours a day is infinitely more dangerous long term.
It's the whole sitting is the new smoking argument. The sedentary lifestyle is the real problem. The adjustment is just trying to undo some of that damage.
Okay, so it's safe, the sound is just gas, but does it hurt? That's question 8. Because if I'm already in a lot of pain, the idea of someone pushing on my spine seems wrong.
And their answer's pretty honest.
Yeah.
Usually, no. It feels like relief, like that good hurt when you finally stretch a really tight muscle.
But there's a catch if it's a new injury, right?
Yes. If you threw your back out yesterday, you're inflamed and tender. So they clarify that, yes, touching that spot might be uncomfortable because you are injured, not because the adjustment itself is doing damage.
And what about after? How do you feel then?
Most people feel lighter, looser right away, But they do say some people, especially first-timers, might feel a little sore, like after a workout.
Yeah.
You just moved muscles that haven't moved that way in years.
They're waking up. That makes sense. Okay, let's move to the part that makes everyone the most skeptical, the business model.
The wallet and the calendar.
Yes. Question 2 gets right into it. The trap. The fear that you go in for a stiff neck and walk out with a mortgage payment and a 3 times a week schedule for the rest of your life.
The weird health gym membership model.
Exactly. And Valley Chiropractic seems so aware of this stereotype. Their stance is just no contracts, no pressure.
But, and this is where we have to get into the weeds a little,
Yeah.
they do explain why it's not a one-and-done fix. It's not a scam. It's just physiology.
They break it down into 3 phases, which I found super helpful.
That's a great mental model. Phase 1 is relief care. This is the put out the fire stage. You're in pain. You can't function. The goal is just to get you out of that acute phase.
And that's pretty short term, right? Like 1 or 2 weeks?
Usually. But here's the problem. People feel better, so they stop coming. But the underlying issue, the reason the fire started in the first place, is still there.
Which leads to phase 2.
Phase 2, corrective care. This is where the real work happens. It takes weeks, sometimes months. Think of it like braces on your teeth.
You can't wear them for a day and expect straight teeth.
Exactly. You are fighting against years of muscle memory. Your body is used to that bad posture. It actually wants to pull your spine back out of alignment because that feels normal.
So this phase is all about retraining the body to accept the new healthy position.
It's neuromuscular re-education, yeah.
Right.
And then, once you're stable, you finally hit phase 3, maintenance care.
And this is where my sales pitch alarm usually goes off.
Yeah.
But their take on this was really different.
It really was. They explicitly say maintenance is your call. They compare it to dental cleanings. You go every 6 months to prevent cavities. You can get your spine checked occasionally to prevent flare-ups.
But they don't force it. I think the phrase they used was old school scare tactics.
Yeah, they're against that. It really shifts the power. It's not the doctor telling you what to do. It's you managing your own body.
Okay, let's talk hard numbers. Because it varies is the worst answer in healthcare. But Valley Chiropractic actually gives a range in question 1.
They do is that transparency thing again. A typical visit, they say, ranges from about $50 to $75.
Which is honestly surprisingly reasonable. I don't think I can get a plumber to even look at my sink for 75 bucks.
It's pretty accessible. And they also make a point to verify your insurance beforehand so you don't get one of those ambush bills 3 months down the line.
And for the timeline, how long this all takes, they give a few scenarios.
Right. Scenario A, you lifted a couch wrong, acute injury, that's a quick fix, 3 to 5 visits.
Scenario B, the classic desk job neck.
The slow burn, you've been staring at a screen for 5 years, that's more like 8 to 12 visits because you have to undo all those bad habits.
And the last one?
Scenario C, the chronic issue, the I've had this since high school problem. That's could be weeks to months. The point is they map it out. It's not a guess.
I want to circle back to the vibe. Another barrier is just feeling awkward. What do I wear? Am I going to look stupid?
I loved their answer to question 7, what should I wear? They just say, you don't need special chiropractic pants.
Which is great, because I definitely don't own any.
It's just practical. Jeans, leggings, whatever you can move in. They're trying to lower every barrier. Just show up.
And what about clicking with the doctor? I think people worry they'll get stuck with someone who's too rough or too chatty or not chatty enough.
This is a huge advantage for a place like Valley Chiropractic. They have 5 different doctors on staff.
That's a lot.
It is. And they say each one has a different flavor. Some are sports-focused, high impact. Others are more into gentle, low-force techniques or functional medicine.
So if I don't vibe with the first doctor I see?
You just switch to another one. They say no hard feelings. They'd rather you see a colleague than stop care because of a personality mismatch.
Let's talk about x-rays. I've heard stories of places that x-ray every single patient just to pad the bill.
Question 6 addresses this, and the answer is really nuanced, which I appreciate. Do you always need them?
No. If you just slept funny, probably not.
But when would you? If there's trauma, like a car accident, or if pain is radiating down your arm, or if you're older and they suspect arthritis, they use them to see under the hood when it's necessary, not just as a standard procedure.
Okay, final stretch. I want to broaden the scope a bit. We think of chiropractors for back and neck pain, but this guide lists so much more. Sciatica, headaches, TMJ.
Desk worker syndrome is really the big umbrella. But what's more interesting to me are the patient groups you wouldn't expect, specifically pregnant women and kids.
Yeah, let's talk about that. Pregnancy. My first thought is, how? You can't lie on your stomach.
They have special tables, with sections that drop away to make room for the belly. But more importantly, let's talk why.
I mean, aside from carrying all that extra weight,
Think about it. Your center of gravity shifts completely forward, and your body is flooded with a hormone called relaxin that loosens all your ligaments. It makes the pelvis and spine really unstable.
so the chiropractor is just trying to keep the chassis aligned while everything is changing.
Exactly. And there's a baby positioning aspect too. A balanced pelvis gives the baby more room to get into the right position for birth.
Wow, okay, and then babies. Question 12. Can kids get adjusted? I have to admit, the image of cracking a newborn's back is alarming.
And that's exactly why the guide clarifies the technique. They are not doing the same kind of adjustment on an infant.
Okay, good.
They describe the pressure as what you'd use to check the ripeness of a tomato. It's just fingertip pressure.
So, why would a baby even need an adjustment?
Well, being born is a pretty traumatic physical event. A lot of pulling and twisting, especially on their neck. Some issues, like colic or trouble latching, can sometimes be linked back to tension from the birth process.
And as they get older?
Then it's learning to walk, which is a series of tiny falls. Then sports, the 50-pound backpack,
Yeah.
and now tech neck from staring down at iPads all day.
So for kids, it's really about preventative care.
It's about making sure the tree grows straight, correcting the small things before they become that big scenario C chronic pain later in life.
We have covered so much ground here. The pop, the safety, the cost, the phases of care. It really feels like Valley Chiropractic is trying to reframe the whole experience.
That's the core takeaway for me. It's an invitation. They're basically saying, we know you're skeptical, we know you might be scared, here's all the information laid bare.
It's about removing all the friction points, whether that's what do I wear or what will this cost me?
And it all comes back to that idea of autonomy. They stabilize you, and then they hand you back the keys to your own body.
You decide how tuned up you want to stay.
Exactly. It's a shift from reactive healthcare, waiting for something to break, to proactive performance and wellness.
So if you're that person sitting in the car right now, stalling, maybe this deep dive gives you that little nudge you need to just open the door.
It's not magic. It's just biomechanics. And according to them, it's backed by 20 years of experience and more than 15,000 patients.
If you want to test the waters, or maybe you have a question 21 that wasn't on their list, you can reach out to them. The team at Valley Chiropractic can be reached at 209-832-9221.
It's 209-832-9221.
Or you can check them out online. The website is super simple, tracychiro.com.
tracychiro.com.
Whether it's a stiff neck, a pregnancy ache, or just the weight of the world on your shoulders, it might be time to find out what being aligned really feels like.
Stay curious.
And stay adjusted. Thanks for listening.